All right, it's notes from No More Hygiene. I'm here with Dr. Tommy Nabors. Good day, Dr. Nabors.
Hello, Steve.
I understand you're going to spoil my dinner today.
Absolutely.
Yeah, so this is not a topic that you're probably coming up if you're watching this at the end of your workday. This is probably not a topic you're going to bring up at the dinner table this evening. So we'll deal with it now so you can decide where and when you want to talk about it. So
Perfect.
Spoil our dinner, Dr. Nabors.
Well, this is a great article, from the title all the way to to what she quotes as the sources. I mean, it's really great. Her name is Carrie McGill, and she has published this in RDH magazine. It's called Gut Health, a link between oral and systemic wellness. And I like what she said in the title because it's a link between oral and systemic wellness. We usually say oral systemic health. So it got my attention, and it's just fantastic in terms of the way that it kind of parallels much of what we talk about in No More Hygiene of systemic disease and how that relates to body health. And we'll kind of describe some of that shortly, but really great article.
All right. So what's the relationship? You're the smart one in the room. What's the relationship to the bacteria in your mouth, right? 700 different types of bacteria in your mouth and the gut in your bacteria. Obviously there's a relationship there, but what do we know about the relationship there and how this impacts what's in your gut?
Well, we use the TOPS phrase a lot, what we know now. And we've been speaking much lately about Alzheimer's disease and that relationship to periodontal disease and Porphyromonas gingivalis and the microbiology of that. That is now, according to her, well, I'll kind of read it because it's very good. We already know about the proven relationship between periodontal disease and diabetes, obesity, and Alzheimer's, as well as cardiovascular disease. But the gut health is less discussed. And she says two things there. One is that the rest of these systemic components, we've already proven that. We've already talked through that. You should already know that. Sort of what's next, or what we know now, is that gut health has a really big role to play in all of our immune response. So that in the gut, and she quotes this in here, about 1 teaspoon of fluid from the gut has about over 1 billion bacteria. And
that's a lot.
When you upset that, when these microbes that we talk about, that PG can invade the epithelial lining of the periodontal pocket, it will enter the bloodstream, it travels throughout the body. Well, eventually it is going to be in the gut. And I'll kind of read from what she says here. She says more than 70% of our immune response comes from cells within the gut. A single drop of fluid from your colon contains over 1 billion bacteria. So the GI system, we all tend to think that's only digestion, but it's actually sort of the heartbeat, for lack of a better word, of our entire immune response. And so when we've got chronic pathogen loads coming from places that aren't resolved, it will alter that system. And when that system's altered, it will decrease the immune response to all systemic conditions, not just one.
So if I'm thinking about this, I mean, we know that, let's take PG, for example. PG can get in the bloodstream, invades everything. Can PG survive? So PG is in my saliva. If I've got periodontal disease and I've got elevated levels of PG, that's in my saliva. If I swallow that, can that survive in my digestive tract and then change the gut biome, or is it only through the blood channel?
Kind of handle that in a couple of different ways. I'll kind of read this because I like her terminology better than me kind of coming just off the cuff. When bacteria invade the sulcus, that's one way. It travels through the epithelial lining of the pocket and then is circulated through the body. It triggers an immune response, which prompts the production of what we call pro-inflammatory cytokines. We talk about that in the course, but all pathogens can do that in the pocket, which those can then enter systemic circulation, causes systemic inflammation. But the dysbiosis, that's a common term, and we'll just call it messing up. It sounds like a term of when things get disorganized of the gut microflora, which they would call microbiota, is one of the first reactions that can happen after periodontal disease. So they note, and it's noted, that P. gingivalis has been shown to provide inflammatory changes in adipose tissue and liver, decrease in gut barrier function, and significantly alter the microbial communities in the gut. So PG, it goes back to what we were talking about before this. PG has the ability to reprogram cells. People don't realize that, but PG is like a computer programmer for other bad cells. And it can write a program that will tell good cells to be bad. That's a very general way to put it. But when you unleash PG, let's say into the gut, where 70% of the decisions are made about how to respond to all sorts of inflammatory conditions, then PG has the ability to alter the way that that is transcribed to the rest of the body. So this is to me, I would call it maybe a capstone type article to combine what we know now in terms of how our body is working. And I think
yeah, the remarkable thing about this, I think, is when you think of, the billions of bacteria that are in the gut, and, that science now has been able to narrow down the few that are causing the biggest problems. I mean, we're talking about, this is not finding a needle in a haystack. This is like finding a wart on an ant. I mean, it is like, to be able to identify, here's the few bacteria that are causing so much problem is absolutely remarkable.
It's phenomenal. So, we talk about this from the very beginning, which is PCR testing, the ability to do polymerase chain reaction testing. That's what our COVID tests are now. It's genetic testing of bacteria. It has changed the game for health, but we are missing it in dentistry when it's right literally under our noses in terms of the ability to identify these types of things early before people have the chance to be systemically sick. And medicine is telling us that, that we used to, I know I'm going long here, but the GI system doesn't start in the gut. It starts in the mouth. That's part of the GI system, and we forget that. And it goes all the way through us. It's one system. So it's pretty remarkable to see where we are now versus where we were 10 years ago and what we're learning. So it's really exciting.
Very cool. All right. Well, we will link the mentioned references with this video. So if you want to know more, you can look at all of the references, but the link between gut health, oral health, all connected. The science continues to advance. Thank you, Dr. Nabors, for your insight for today. Enjoy your dinner this evening.
You too.
Thanks for joining us for Notes for No More Hygiene. We'll see you next time.